If your erections aren't as strong, if sex feels more like pressure than pleasure, if you're secretly wondering if this is just part of getting older, this video is for you. Every man faces changes in his body over time. But one change that hits harder than most is losing confidence in the bedroom. The good news? Science is catching up fast. In 2025, erectile dysfunction isn't the dead end it used to be. It's a signal. And if you understand what it's telling you, you can take action that actually works. If your erections aren't what they used to be, there's a reason. Erectile dysfunction, or ED, is one of the most common health issues men face, especially as they get older. And in 2025, we have more tools, research, and real solutions than ever before. Hi, I'm Dr. Max, urologist and men's health expert, and someone who's spent years helping men navigate issues like this with clarity and without shame. Today, I want to walk you through what's actually working right now in the treatment of ED. We're talking about the latest breakthroughs, not the outdated myths or quick fix scams. Let's get into it. One of the biggest barriers men face when dealing with ED isn't just the physical limitations, it's the loss of confidence. The anxiety, the quiet shame. When medications don't work or lose their effectiveness, that emotional toll only grows. PRP therapy offers something different, not just hope, but control. You're not relying on an external chemical. You're harnessing your own biology. That's a powerful shift. It reframes the problem from something broken to something that can heal. There's also a growing body of research showing that combining PRP with lifestyle interventions, things like improved nutrition, exercise, and stress management, can amplify results. That's because blood flow, nerve sensitivity, and even hormone levels are deeply connected. PRP may kickstart the recovery, but your day-to-day choices help sustain it. And for men dealing with other conditions that affect sexual function, like diabetes, high blood pressure, or post-prostate surgery, PRP is emerging as a particularly valuable tool. It's adaptable. It meets your body where it is and gives it the push it needs to rebuild. So if you felt like the systems let you down, or like you're stuck choosing between silence and pills, know this: PRP represents a new chapter in ED treatment. One that's personal, proactive, and built around the idea that your body still has the power to heal. Let's dive deeper into the promise and potential of stem cell therapy for ED, because while it may still carry the label of experimental, the science behind it is anything but vague. Stem cells are like the body's raw materials. They're unspecialized, which means they have the remarkable ability to transform into various types of specialized cells, muscle cells, nerve cells, even the cells that line your blood vessels. This regenerative power is why they've been making headlines in everything from orthopedic repair to heart disease. And now, we're seeing that same potential applied to something deeply personal, erectile function. In the context of ED, stem cell therapy offers a completely different approach from pills or pumps. Rather than trying to force an erection chemically or mechanically, it seeks to restore the biological systems that make erections happen in the first place. Most commonly, stem cells used for ED are taken from the patient's own body, typically from fat tissue through a small liposuction procedure, or less commonly from bone marrow. These cells are then processed and concentrated before being injected directly into the penile tissue. Once there, they don't just sit idle. They interact with local cells, release signaling proteins, and begin stimulating the repair and regeneration of blood vessels, smooth muscle, and nerves. This is critical because for many men, ED is not simply a mechanical issue. It's vascular, it's neurological, it's hormonal, and in many cases, it's a combination of all three. Stem cell therapy speaks to each of those systems at once. In recent clinical studies, men treated with stem cell injections have reported noticeable improvements, not just in the ability to achieve and maintain erections, but also in sensitivity, spontaneity, and overall satisfaction. Some even regained nocturnal and morning erections, which are strong indicators of underlying health returning to normal. One of the most exciting aspects is its potential for men who have been hardest to treat with traditional methods, like those with diabetes, those recovering from prostate cancer treatment, or those with long-standing vascular issues. These are the men for whom oral medications often fail. Stem cell therapy may offer them a way forward. That said, It's important to be honest. Stem cell therapy is still under study. It's not yet FDA approved specifically for ED, and the cost can be significant. But the safety profile is so far is encouraging, especially when the cells come from the patient's own body. And as techniques improve and regulatory clarity increases, we're likely to see more widespread use and more accessible care in the near future. So if you're someone who's been told there are no more options, or you've tried the standard treatments without success, stem cell therapy is a frontier worth watching closely. It doesn't just aim to fix what's broken. It aims to rebuild it. And that's a radically hopeful idea. Another powerful option that has become more popular in 2025 is low-intensity shockwave therapy. Starting with low-intensity shockwave therapy, often abbreviated as LSWT, this is one of the most exciting non-invasive options now widely available in 2025. The principle is simple, but the science behind it is powerful. LSWT uses focused acoustic waves to stimulate what's known as neovascularization, the formation of new blood vessels. For men with ED, especially those whose difficulties are tied to poor circulation or endothelial dysfunction, this is key. Endothelial dysfunction means the inner lining of the blood vessels, the part responsible for relaxing and allowing blood flow, isn't doing its job properly. This is common in men with diabetes, hypertension, or even just age-related vascular wear and tear. Without adequate blood flow, an erection either doesn't happen or isn't strong enough to be satisfying. Shockwave therapy tackles this directly. During the treatment, a small handheld device delivers pulses of energy to the penile shaft and sometimes to the perineum. It's completely external. There are no needles, no anesthesia, and typically no discomfort. Sessions are brief, often lasting just 15 to 20 minutes, and most protocols involve 6 to 12 treatments over a few weeks. The result? Improved natural blood flow, stronger erections, and in some cases, the return of spontaneous erections without the need for medication. In 2025, the technology behind these devices has evolved significantly. We now have more precise energy settings, better anatomical targeting, and real-time feedback systems that help clinicians personalize the intensity and location of the therapy based on your unique vascular needs. And while not every man responds the same way, the overall data is promising, especially for those who either can't tolerate medication or want a drug-free solution. Now let's talk about something that impacts not just sexual performance, but energy, mood, and even motivation: testosterone. Hormone replacement therapy, or HRT, has taken a big leap forward. Testosterone is a central hormone in male health. It supports libido, muscle mass, energy levels, and yes, erectile strength. Low testosterone, also known as hypogonadism, is more common than most people think, especially after age 40. And while ED isn't always caused by low testosterone, it often plays a major role. The newer HRT protocols are much more refined than the scattershot approaches of the past. We now use bioidentical testosterone, molecules that are structurally identical to what your body naturally produces. This helps reduce side effects and improve absorption. Even more importantly, we have better delivery systems, subcutaneous pellets that slowly release testosterone over months, long-acting injectable formulations that maintain steady levels, and transdermal gels for those who prefer daily application. But what truly makes today's HRT more effective is how it's monitored. Thanks to advanced blood testing and digital health tools, doctors can track hormone fluctuations much more precisely and make adjustments on the fly. That means faster symptom relief, fewer mood swings, and better sexual health outcomes. For many men with confirmed low T, restoring optimal levels changes everything, not just their erections, but their confidence, drive, and daily resilience. Now, for the men who still benefit from oral medications, there's good news there too. Drugs like sildenafil and tadalafil, better known by their brand names Viagra and Cialis, remain highly effective for many. But in 2025, we're seeing new dual-action medications come to market. These combine PDE5 inhibitors with other compounds that support nitric oxide production, enhance tissue oxygenation, or prolong the effect of the medication. The result is faster onset, longer duration, and a smoother experience with fewer side effects. We're also moving toward more personalized dosing. No longer is it a matter of taking a standard 20 milligram pill and hoping for the best. Based on your health profile, responsiveness, and even your hormone levels, doctors can now tailor the dosage, sometimes using compounding pharmacies to customize a formulation specifically for you. But here's the thing. All the technology in the world doesn't help much if the root problem isn't physical. For many men, ED has just as much to do with the mind as it does with the body. Performance anxiety, past trauma, relationship stress, even subconscious fear of failure. These are powerful forces, and they can sabotage even the most physically healthy man. That's why more clinics are now including mental health support as part of ED treatment. Cognitive behavioral therapy helps men break the cycle of negative thoughts and self-doubt. Mindfulness practices reduce anxiety and increase body awareness. Sex therapy, sometimes done solo, sometimes with a partner, can repair emotional disconnects that feed into ED. And most importantly, when mental health care is integrated into the physical treatment plan, the results tend to be deeper and longer lasting. So when we say erectile dysfunction is more treatable in 2025 than ever before, we don't just mean there are more products. We mean there's a whole new framework, one that looks at the body, the mind, the lifestyle, and the underlying health patterns that all interact in sexual performance. If you're struggling with ED, don't wait. Talk to a specialist. Ask the right questions. And most importantly, know that you are not alone. Stay strong, stay informed, and I'll see you in the next video.